And I will turn it back over to Molly to talk about eligibility.
Sure. Thanks, Adam. So we should be on slide 13. So who is eligible to participate under MIPS? You're eligible to participate under MIPS if you are considered a physician assistant, a nurse practitioner, a clinical nurse specialist, or a certified registered nurse anesthetist. One thing I do want to note is that physicians under Medicare include not only doctors of medicine and doctors of osteopathy, but also dentists, podiatrists, and optometrists, as well as chiropractors. You're also eligible to participate in the MIPS if you bill more than $30,000 annually in Medicare Part B, and if you see more than 100 Medicare patients in a year. So let's move on to slide 14, where there's an example of what this actually means. So in this example, we have Dr. A, who he is an eligible clinician. He has billed $100,000 in Medicare Part B charges and has seen 110 patients in a year. Therefore, Dr. A is eligible for MIPS. So let's move on to slide 15. So who is exempt from MIPS? So you are exempt from MIPS if you become newly enrolled in Medicare for the very first time in calendar year 2017. So again, this would be the first time that you enroll with Medicare. This doesn't deal with circumstances where you used to work in a practice in Iowa and now you've moved to another practice. This is when, for the very first time you enrolled in Medicare, you would be exempt. I'll come back to this middle one because I want to explain the low volume threshold in more detail. The one on the right-hand side deals with significant participation in an advanced APM. APMs are the other track of the quality payment program. There's the MIPS track and the APM track. And if you successfully participate in an APM to certain thresholds, you would also be exempt from MIPS. For the middle exemption, the low volume threshold, again, that low volume threshold is $30,000 and 100 patients, but you'll note in this slide, on slide 15, we're using an or here, whereas in the prior slide we said 30,000 and 100 patients. So let's go ahead and jump to slide 16 for an example to talk us through this. So Dr. B, so she's an eligible clinician. She billed $100,000 in Medicare Part B charges, but she only saw 80 patients. So she would be exempt from MIPS because she did not see more than 100 patients. The reason why this context changes of if it's 30,000 or 100 patients or 30,000 and 100 patients, it changes when based off of the perspective that you were talking about it from. So if we're talking about it from an eligibility perspective, you're eligible if you bill more than 30,000 annually and see 100 patients. You're excluded if you bill 30,000 or bill less than or equal to 30,000 or less than or equal to 100 patients. It becomes a double negative. I apologize for that. I realize that can be slightly confusing. So I hope this helps clarify it. If it doesn't, we're more than happy to talk through this in more detail later on. So let's go ahead and jump to slide 17. So what does it mean if you are exempt? If you're exempt, that means that you don't have to participate. You can, however, volunteer to participate. So you can volunteer to participate in any one of the performance categories. This could benefit you because you may be eligible in a future year. Maybe you're not eligible in this first year due to falling below that low volume threshold we were talking about. but you suspect that your Medicare patient population may increase in future years, or it could be that you are part of a clinician type that's not eligible now, but you were previously eligible under the PCAHs program, and you want to continue to participate. If you do volunteer, we will still provide to you informative feedback, but you won't be able to receive any of the payments that are associated with MIPS, whether those would be bonus, incentive payments, or the negative penalties. Let's move on to slide 18. So eligibility for certain types of facilities. So rural health clinics and federally qualified health centers, they're not subject to the MIPS payment adjustment. However, eligible clinicians that work in RHCs or FQHCs that bill under the physician fee schedule are required to participate in MIPS. And then let's move on to slide 19 for information on critical access hospitals. So you're eligible to participate, apologies, if you participate in Method 1, clinicians themselves would be eligible to participate, but the payment adjustments would not apply to the facility of the critical access hospital itself. For Method 2 critical access hospitals, for clinicians who have reassigned their billing rights over to that critical access hospital, they are able to participate. So similar to how you were able to participate under the Meaningful Use or PCAHs program. And then for eligible clinicians who have not assigned their billing rights over to their CAH, the payment adjustments would apply similarly to the Method 1 critical access hospitals, meaning that it would apply but not to the facility itself. So let's move on to slide 20. So our last special eligibility scenario is for the non-patient-facing clinicians. So these clinicians could include pathologists, certain types of radiologists, certain types of anesthesiologists, etc. These non-patient-facing clinicians are eligible to participate. They're not exempt. Rather, these types of clinicians, they have a little bit more flexibility in what they're required to do, which I'll talk about in more detail later on. But you would be considered a non-patient-facing clinician based off of a certain threshold. If you participate as an individual, that threshold is less than or equal to 100 patient-facing encounters. And then if you participate as a group, it would be that 75% of your clinicians would have to meet that 100 threshold.